For all of you graduating medical students that are starting residency, you might feel overwhelmed, you might feel scared, but I'm gonna break this down to 5 rules you had from preschool. If you can do these, you will be successful in your residency, and you can follow preschool rules. Number 1, looking eyes. Go and see the patient. That's so stupid, Dr. Bowers. Of course we go and see the patient. No, you won't. You will not see the patient. You go and see that patient every time, and a couple things are gonna happen. You're gonna remember. In the future, when you're asked about it again, it will help you remember when you have these big, long lists of patients. The best way to remember all the different details about them is to go and see the patient and make that synapse, that connection with them. It will help you remember, and you will catch things. So number 1 rule is looking eyes. Number 2, listening ears. You will miss vital information if you are not listening. And guess what? Once again, you're not gonna listen. You're either gonna be distracted, you're gonna be tired, you're gonna be hungry, and you are gonna miss critical information. And who do you most often not listen to? The patients and the nurses. Listen. They will give you information that others will miss and that you will miss if you do not follow the preschool rule number 2 of listening ears. It will lead to you catching things that will save lives, that will be critical information that is gonna help you make diagnoses and provide treatment plans. Number 3, quiet voices. It is so easy to get upset during your residency. People will do the craziest things and it will make you so mad. Gather yourself, maintain your inner stillness. If you remember to use your quiet voice, rule number 3 from your preschool rules, it is gonna help you go a long way. Nobody likes to be around the resident doctor that's off the handle all the time and screaming and yelling at everybody. And you didn't respect those people either when you were a student. Quiet voices. Maintain your composure. That'll go a long way towards being a successful resident. Number 4, helping hands. Be the resident, be the doctor. How about be the human that is helpful to other people when they need help? Don't always wait to be asked. If you see someone struggling, help out. And the best residents, those that really stand out and everyone in the hospital knows is on top of their games, not only take care of themselves and follow those other preschool rules, but they're always looking to help other people. Be that kind of doctor. That's the one you always wanted to be. You can do it. Choose rule number 4, have helping hands. Rule number 5 from preschool, walking feet. You may not think that applies very much here because you have to be running during residency. But here's the thing about walking feet. When you go look that up for the preschool rules and what that means, these little children in preschool are learning when it is appropriate to walk and when it is appropriate to run and hustle. And not just in neurosurgery where I train, but in all of residency, you are learning when it is appropriate to walk and when it is appropriate to run. The most dangerous thing about you as an intern is you do not know what you do not know. So the whole big purpose of residency, and even as into attending, is walking feet. When is it the time to walk? When is it the time to run? When is it appropriate to do so? You need to learn all the knowledge, all the pathophysiology, all the presentations, management, so you know when to walk and when to run. And that is what you are doing every day as you learn about these different diseases and processes. And finally, the 6th rule I would add is dream big. You can go and be that doctor you always wanted to be and change the world if you stay true to yourself and don't compromise your values and your morals. So dream big, you're gonna do amazing things, and just remember your preschool rules and you'll do great.